Hi there. Welcome to Learning Thursdays. I am Patty Corbett Ward, and I am a trainer with the Learning and Development Unit at OASAS here in Albany. However, right now, I am your hostess for this presentation of Learning Thursdays. The presentation, as you can see, is entitled Teen Dating Violence and Substance Use. It's a different format in that today we have 5 speakers who all work together to collaborate and put together this PowerPoint for you. We are offering you this PowerPoint in February, as February has been designated as Teen Dating Violence Awareness Month. In a moment, I'm going to introduce you to Brenda Bannon, who is the speaker for this presentation. However, before I do that, I would like to spend a moment again and just give you an overview of Learning Thursdays. So Learning Thursdays was developed as a way to offer a free learning opportunity to those who work in our field with the goals of improving the knowledge, the skills, and the attitude of the workforce as we strive to improve the lives of individuals in prevention, treatment, and recovery. As always, if you have any questions, feel free to send them to our mailbox, learningthurs@oasas.ny.gov. All that being said, I would like to hand it over to Brenda Bannon, who will give you a brief overview of the initiative and introduce you to the 4 speakers after her. So thank you, and thank you, Brenda.
Thank you, Patty. My name is Brenda Bannon. I work at the New York State Office of Alcoholism and Substance Abuse Services, and I am the chair of the New York State OASAS Intimate Partner Violence, Domestic Violence Workgroup. The IPDV Workgroup is a group that was reinvigorated back in 2011 when I became the chair of that group. It is designed to address the various and considerable domestic violence issues that we see throughout our treatment system for OASAS. The work group was reestablished actually in 2011, and we initially updated a local service bulletin, which was issued in 2012 on screening and referring for domestic violence in our treatment and recovery and prevention programs. We developed web pages and have resources available for our providers, and we also began promoting awareness of domestic violence by participating in Domestic Violence Awareness Month in October and Wear Purple Day in the middle of October. This year, we were able to present on teen dating violence awareness during Teen Dating Violence Awareness Month here in February, and we were able to put together a panel of experts to present on that topic. The Intimate Partner Violence Work Group does the work of the New York State Intimate Partner Violence Domestic Violence Advisory Council. We have an executive team member at OASAS that is a representative on the council, and the council exists to promote effective intervention and promote the development of appropriate policies throughout the state surrounding domestic violence. And it has members from many, many state agencies that come together on a quarterly basis. Our work group team we invited participants on that group from every division in the agency at OASAS, as well as from each of our addiction treatment centers. So we're fortunate to have a group of very dedicated and very intelligent people who come together to help us address domestic violence in the New York State substance use disorder system. Today we have Sarah Hirsch from the New York State Office of the Prevention for Domestic Violence, Janelle Riccio, who is from New York State OASAS and is in our adolescent services, Liam Cudmore, who is from the Center LGBT Community Center, and Walt Davies, who also is from OASAS in the Prevention Bureau. And my name is Brenda Bannon. I am from OASAS. I'm an addictions program specialist and the chair for the domestic violence work group. I'm going to hand this off to Sarah Hirsch from the Office for the Prevention of Domestic Violence. She is a domestic violence program specialist.
My name is Sarah Hirsch, and I'm a domestic violence program specialist from the New York State Office for the Prevention of Domestic Violence. I'm a member of the healthcare team where we were contracted by the Department of Health to provide training and technical assistance to Enough is Enough service providers. February is Teen Dating Violence and Teen Dating Abuse Awareness Month, so I'm here today to talk about what that looks like, how you can look out for it, and what you can do about it. The Office for the Prevention of Domestic Violence is the country's only executive-level agency that deals with domestic violence. Our goals are to advise the governor about policies and procedures, to provide public awareness and resources for local programs and communities, as well as train New York State professionals. Our goal is to improve New York State's response to and prevention of domestic violence with the goal of enhancing the safety of all New Yorkers in their intimate and family relationships. If you'd like to know more about what the Office for the Prevention of Domestic Violence does, you can check out our website. So when most people think about domestic violence, they typically think of an adult male as the abuser, an adult female as the victim, and they think of bruises and black eyes and police and violence and fear. But domestic violence is so much more than that. It can affect adults, it can affect teens, it affects people of all races, all genders, in all kinds of relationships, and it does not discriminate. So when we're talking about teen domestic violence, we're also talking about teen dating abuse, because it's not just about the physical. Teen dating violence or teen dating abuse is a pattern of coercive tactics which can include physical, psychological, sexual, economic, and emotional abuse perpetrated by one person against an intimate partner with the goal of establishing and maintaining power and control. It is not just about what the abuser is doing, it's about why they're doing it. And they're doing it to gain power and control. And I'm going to say that over and over throughout my presentation so that you know it's not just about that black eye, it's about wanting to create a relationship where their partner, their victim, is dependent on them. So let's talk about some of the facts. In the U.S. alone, 1 in 3 adolescent girls is a victim of interpersonal violence, and that's just of the victims that we know of that report. 80% of teens say they know someone who has been controlled by a partner. Nearly 20% of female high school students and 13% of male high school students report being physically or sexually abused by a dating partner. And 26% of teens in relationships were victims of cyber dating abuse, with females being twice as likely to be victims as males. So the reason I wanted to talk about these statistics is to make it relevant to you. Looking at these stats, we know that if you're working with teens, you are working with a victim, you just don't know it. And you're probably working with a perpetrator as well. The reason you don't know it is because they're not telling us. Teens, just like adult victims of domestic violence and dating abuse, aren't reporting it for a variety of reasons. They feel shame, they feel guilt, they feel like they're not going to be believed, and they feel like it's their fault. So the best thing we can do when we don't know who a victim is treat everyone with trauma-informed care and support. While I will be mostly talking about the signs and responses of abuse, I also want to address how it intersects with substance use. Research shows that there's a strong correlation between dating abuse and substance abuse, but I want to be very clear when I say that substance use and abuse does not cause dating abuse or domestic violence. It is all about power and control. There are plenty of people who use substances that don't abuse their partner. Research shows that alcohol and drug use and abuse may exacerbate it. There may be more violent situations when alcohol is consumed, when drugs are used. Victims might be using alcohol and drugs to cope with the abuse, and also people who use and abuse alcohol and drugs are more likely to be in relationships where there is abuse. So while there is a very strong correlation, which is why we need to address it, there is no research supporting that it is causal. So when we're talking about abuse, we're talking about the different types of tactics that abusers are using to control their victim. The one we think of most frequently is physical abuse. The definition of physical abuse is any unwanted physical contact or any physical contact that causes injury. This can include pinching, kicking, hitting. Those are more obvious ones. There's also restraining a partner, holding them down, holding them back, grabbing them and pulling them, standing in the doorway and keeping them from leaving if they want to get out, slapping, punching, shoving and pushing during, an argument. But like I've said before, abuse is way more than just a bruise or a black eye. And it's the tactics of abuse as a whole that contribute and create a powerful impact and lead a victim to often stay with their abuser. So if teens are not telling us about emotional and physical abuse, they are definitely not telling us about sexual abuse because it is more intimate, because it is private. Sexual abuse can look different in different relationships and different violent situations. So there is clear physical force when we think about rape and sexual assault. There's also coercive pressure, telling someone, you're my girlfriend, you have to do this, or talking to their boyfriend saying, well, we did this last night, I want to do it again, you have to do it. Making it difficult or impossible for a partner to say no to sexual activity or behavior, threatening them, intimidating them, saying that, in the case of addicts, saying, if you don't do this, I'm going to tell your family you're using again. Preventing a partner from using birth control or other forms of contraception, or forcing a partner to get pregnant or continue on with the pregnancy, have the child. Forcing a partner to have sex with other people in exchange for money or drugs. We see this a lot, and this is where domestic violence and dating abuse intersect with human trafficking. We see this really frequently where abusive partners are forcing their victims to have sex with other people for money or for drugs, and then if they get arrested, it's all on them. So teens are on screens constantly, which is why we're seeing a real increase in technological abuse being a main tactic in relationships where one person is trying to maintain power and control. Some examples are impersonating a partner online, publicly posting negative comments about a partner, constant harassment, constant texting, where are you, answer your phone right now, call me back, why aren't you calling me, tracking them using geotagging or a GPS, trying to figure out where they are at all times. So using cell phones, the internet, and other technology to stalk or harass a partner. But we also see it intersecting with other tactics, saying, if you don't do this for me, then I'm going to show that picture or video of you using or drinking. I'm going to post it on the internet. I'm going to send it to your friends. It's going to go all around school. So the tactics that abusers have been using for years and years are now just moving over to the technological world and being used online, which is a really powerful thing. Psychological abuse is often how these kinds of relationships start. It starts small. It starts with some name calling, a little bit of blame, a little bit of guilt, and then it slowly grows and exacerbates all the time. And psychological abuse and emotional abuse are really intertwined, but while emotional abuse can look like calling someone names, psychological abuse is often crazy making. So if a victim was drinking and their partner knows that they have a problem with drinking, they could say, "I never hit you last night, you were drunk, you don't remember." Or, "This is what happens when you drink. This is what happens when you use, you made me do it." Yelling, screaming, insulting, intimidating a partner, spreading rumors or threatening to spread rumors, threatening to leave or hurt their partner if they leave, threatening to hurt themselves. So I'll OD if you leave me, I'll kill myself, this will be all on you. And then the key component that we see across abusive relationships is that the abuser always minimizes, denies, and blames their partner for the abuse. So telling their partner they can't leave the house is obviously a form of maintaining control, but they'll say that they're doing it for them because they know if they leave, they'll use. Or, "If you see this certain group of friends, I know you'll drink again." So they're making their partner crazy because they're making them think that it's their fault, that the abuse is because of them. And that's a really key reason that a lot of victims stay with their abuser, is because they feel the guilt, they feel the shame, they don't know if they can trust themselves and their intuition, and they think that it's their fault. Now, we know that teens are just as likely to be in abusive relationships as adults are. We know that there are some differences, but what we also see is that people within marginalized populations who face a unique set of challenges are not only more likely to use drugs and alcohol, but are also more likely to be victims of dating abuse. So one of the populations that we see that has a unique set of circumstances is teens in the LGBTQ community. We know that LGBTQ youth are more likely to leave home and be more dependent on other people because of their sexuality, because of how they're treated by their family and friends. And we see abusers use this set of circumstances as a way to abuse. So an abusive partner may out their victim or make their partner feel bad about their sexual orientation or sexual history. We might see an abusive partner threaten to alienate their partner from the gay community. If they come out, no one will believe you, they're all my friends, you'll get kicked out, you'll have no one. And we might see an abusive partner telling their partner that the police and counselors are homophobic, no one will believe them, no one will believe that I'm doing this to you, I'm smaller than you, no one will believe that a woman is abusing their partner because everyone thinks that it's only men. So abusers are using whatever tactics they can to maintain control over their partner. And all of this is intertwined with substance use because this may cause someone to be using drugs and alcohol to cope even more. Teens with disabilities are more than twice as likely to be victims of relationship violence than teens without disabilities. They may have already been more reliant on family, friends, and partners and assistive devices that an abuser can use to control them. You know, if your partner is abusing you, but your partner is also the only way that you can get food or go to school or see your friends, you're probably going to stay with them because you're more dependent on them. They might have cognitive or intellectual disabilities that make it more difficult to recognize the signs of abuse, and they may be unable to legally consent to sexual activities and not know what's going on to them is wrong. Abusers also frequently use their partner's disability to break down their self-esteem. No one will love you because you're in a wheelchair. You're stupid, you're not good at anything. We see these things all the time, which is making victims more likely to stay in their relationship because they believe their partner. They believe that no one else will love them because of their disability. They believe that it is their fault. They believe that it is difficult. So in order to prevent this situation, what we need to do is we need to educate people about the signs and make sure that they know that there is help available. Pregnant and parenting teens also have unique experiences, and we see that adolescent girls in physically abusive relationships are 3 times more likely to become pregnant than non-abused girls. They might not be able to refuse sex or use birth control. I had a client several years ago whose partner wanted to have sex with her every night, and if she said no, he would put his pocket knife on the bedstand. So he didn't have to physically force her. He didn't have to guilt her into it because she knew what that knife meant. She could not say no. Abusers might force their partner to stay pregnant and have the child because if there's a child involved in the relationship, that child is usually used as a tactic of control as well. Parents may have abandoned their pregnant teen, which would lead to an increased dependence on their abusive partner. Teen parents often drop out of school, which makes it more difficult for them to find employment, and then they become financially dependent on their partner. And like I said before, abusive partners often threaten to hurt the child, take away the child, anything they can to maintain control over their partner. Runaway and homeless youth are also extremely vulnerable to this situation because of their circumstances. 6 in 10 homeless or formerly homeless youth have been in violent dating relationships. This is because of a variety of reasons, and just a few of them are that many transitional shelters don't screen for dating abuse during the intake process. I'm sorry, that slide should say don't screen. But if they are not looking out for dating abuse, they're not going to know the signs and they're not going to get the help that they need. Many youth living on the street are more likely to be exploited and trafficked into the sex trade because they're trying to get their basic needs met. They might think that relationship abuse is normal because so many of them experienced abuse at home and have only seen abusive relationships. And many of them are not able to work because of their age, so they're forced into sex work, again, just to get their basic needs met. So as a clinician, it's really important for you to know that while you can't fully stop dating abuse, there are a lot of things you can do. First thing is, when you're working with your clients, be patient. Talking about abuse takes time, and not everyone is able to hear it or understand it right away, especially for teens. When teens think about domestic violence, they don't think about what's actually happening to them, especially if their situation has not escalated to physical abuse yet. So using words like abuse and dangerous and violent and domestic violence, that might not the teen might not recognize those words and see that as what's happening to them. So being patient and just being a safe space is really the number one thing that you can do. Remind the teen that the abuse is not their fault and that you support them, that they're not alone. Their abuser has more likely than not blamed them for everything that has happened. So their self-esteem has been broken down. They feel shame, they feel guilt. And they might also love their partner and not want to leave. So reminding them that it's not their fault and that it's not anything that they did to deserve this is another really important step you can take. And listen. People are going to do what they're going to do, teens especially. So you saying this relationship is bad for you, you need to leave, is not going to get them to leave their relationship. What you need to do is listen, validate their experience, validate what they're going through, tell them that they're not doing anything wrong, and just always be there. And this way in the future, if they are ready to leave their abusive relationship, they know that they have someone they can turn to help get them out. There are some other ways that you can support them. Help them create a safety plan so that they know what to do in case of future incidents. A great thing you can do is reach out to your local domestic violence program who can help you work with the teen to create a safety plan. They can do safety plans if they want to leave their abuser. They can do safety plans if they decide to stay with their abuser to make sure that they are the safest they can be within the situation they choose. And they can talk about their options in terms of getting orders of protection, going to the police, going to family court. And we like to believe that victims, even teens, know their situation best. They know their abuser best. So just being there to support them and lift them up and let them make decisions is what really creates a difference. Don't try to mediate. with the victim and their abuser, because remember, there's a power differential going on. So even if a victim decides they want to leave this relationship, if you're trying to mediate the situation with their abuser who's been controlling them for a very long time, chances are they're not going to speak their mind, they're not going to speak up, and letting the abuser know they're thinking of leaving could actually end up being fatal for the victim. Like I said, don't try to force them to make a choice unless you truly feel it is the only safe choice for them. You'll have to check with your supervisors about policies in terms of confidentiality and reporting. So I would look into that before you make any decisions, but our best practice model is not to make decisions for victims. And you could always reach out to others if they're comfortable with it. You don't want to start talking to people about their situation because it could put them in harm's way. So always ask them first, but creating a really strong support system is going to help a victim be more likely to make choices that will keep them safest. Like I said, February is Teen Dating Abuse Awareness Month, and the Office for the Prevention of Domestic Violence every year runs a campaign, and the theme of our campaign this year is #NotJustPhysical. The goal of that campaign is to get out there and to show teens that even though there might not be physical violence in your relationship, that doesn't mean that it's healthy. We want to get the word out that emotional abuse, psychological abuse, sexual abuse, tech abuse, all of these things are abusive. So we do have our social media campaign, #NotJustPhysical. We have advertisements on Instagram and Snapchat that are targeting teens to get the word out there. And those images are on the next slide. There are plenty of resources available if you or a teen you're working with needs help. There's the National Domestic Violence Hotline, the New York State Domestic and Sexual Violence Hotline. There are peer advocates, there's online websites, the governor's website, New York State Teen Dating Violence, and the best thing I could do is tell you to collaborate with your local program, the people who specialize in domestic violence and dating abusive relationships, because they will know how to work directly with your teen, with your client, to get them the help that they need and the help that they want. So here are just some important links and numbers, and if you have any questions, you could always reach out to me at OPDV or anyone else at the agency if you need any assistance or have any questions. And now I'll turn it over to Janelle.
Thank you, Sarah. My name is Janelle Riccio, and I am the Youth Clubhouse Coordinator for New York State OASAS. So we know that one of the factors that increase risk of harming a dating partner includes substance use. Intimate partner violence and substance abuse is addressed on the OASAS website with various resources of information for parents, teens, and providers. Screening should apply to all people. Although research shows that women and girls are more likely to be victims of domestic violence, abuse does not discriminate. Men and boys are also victims of abuse, and using a uniform screening tool will help to decrease the stigma that only women and girls are impacted by domestic violence. Additionally, because a high number of abusers are men and boys, using a screening tool across the board will show them that domestic violence is something that clinicians are looking out for. One of the resources for teens that OASAS has are youth and young adult clubhouses in various areas throughout the state. The purpose of a clubhouse is to serve adolescent youth and young adults who have or are at risk for a substance use disorder and/or co-occurring mental health disorder. The clubhouse should provide a safe and inviting place for adolescent youth and young adults to develop pro-social skills that promote long-term health, wellness, recovery, and a drug and alcohol-free lifestyle. Programming at clubhouses are youth-driven. Although clubhouses are non-clinical in nature, through developing rapport with staff members, youth and young adults may begin to feel comfortable about talking about significant issues in their lives, such as teen dating violence. If that were to happen, the clubhouses network with community connections of counselors, SUD providers, and schools to help youth connect with outside resources. Once a youth is engaged with a community connection, The provider should use recommended screening tools to help identify individuals affected by intimate partner violence within the prevention, treatment, and recovery service system. Providers should also establish working relationships with local intimate partner violence programs and providers in order to refer and offer appropriate services. Finally, it's important for providers to participate in continuing education and training about the relationship between intimate partner violence and substance abuse. Now I'd like to turn it over to Liam.
Hi, I'm Liam Cudmore. I'm a licensed social worker and the Youth Clubhouse Coordinator at the LGBT Community Center in New York City. I'm here to talk about the experiences of LGBT youth and teen dating violence. So we'll start with the myth that LGBT couples do not experience teen dating violence, and that teen dating violence only occurs within heterosexual relationships between cisgender people where the man abuses the woman. But in reality, we know that LGBT couples experience similar, if not higher rates of teen dating violence than their cisgender and straight counterparts. There's very little empirical research on this topic, and we need a lot more of it. But the Urban Institute did release a study that found that lesbian, gay, and bisexual youth experience teen dating violence at a rate of 42.8%, where straight people experience it at 29%, and transgender people experience it at an alarming 88.9%. So as Sarah mentioned, the vulnerabilities and tactics of abuse differ among marginalized communities, and the same is true among LGBT community. So I'm going to talk about the unique experiences that LGBT youth experience when it comes to teen dating violence. And I just want to make it clear that LGBTQ identity does not cause dating violence. It is a result of the way that the LGBT community is treated by society that makes them vulnerable to dating violence. So here are some of the unique challenges and experiences that LGBT youth experience when it comes to teen dating violence. To maintain power and control, an abusive partner might threaten to out the survivor to friends, families, employers, classmates, teammates. For an example, an abusive partner might threaten to tell the entire school that their partner is bisexual. Young people are especially vulnerable to being outed because at this point in their life, they may not be out to all domains of their life. And it's especially risky to be outed without consent to one's family for the reasons of being rejected or even kicked out of their home. Transphobia is used to perpetuate dating violence. This includes using the wrong pronoun or name, especially in public, referring to the trans partner as it, hiding chest binders, telling the trans partner that because they are transgender, they are a freak and do not deserve love and are not worthy and nobody else will want them, and touching body parts that the trans partner is not comfortable with being touched. For transgender folks who take hormones, such as estrogen or testosterone, and depend on these medications so that they are able to live in their correct gender, an abusive partner may exploit this dependency by withholding or threatening to throw out their hormones. Due often to family rejection, homelessness is a common experience of LGBT youth, with 40% of the homeless youth population in New York City being LGBT identified. LGBT youth also commonly experience poverty. Because of housing and financial insecurity, these youth may depend on an abusive partner for shelter and basic resources, which can both be exploited by an abusive partner and inhibit a survivor from leaving. Domestic violence shelters tend not to be welcoming or equipped to support LGBT individuals, especially transgender individuals. Intersecting forms of oppression exacerbate the LGBT survivors' experience of dating violence. Ableism, racism, ageism, sexism, classism, anti-immigration bias, anti-HIV bias. These create barriers for a youth accessing necessary resources such as safety planning, crisis intervention, supportive counseling, healthcare, law enforcement support, legal remedies, shelter, and housing. For example, a survivor of domestic violence who does not have legal immigration status may be reluctant to call police during an abusive episode for fear of being deported. LGBT individuals often experience not being taken seriously or believed when reporting abuse to law enforcement because of the myth that relationship violence only occurs in heterosexual relationships. There is also a fear if you're the more masculine partner, you will be presumed to be the abuser. Fear of continued victimization by law enforcement, criminal justice, and social service workers keep many relationship violence survivors in same-sex relationships from seeking assistance and safety. There are few LGBT supportive resources to begin with, and sometimes what happens is that both partners in the relationship will utilize the same social service organization, alienating the survivor from the supportive resource. Similarly with co-opting of resources, there can be a co-opting of community. Because of discrimination from society, LGBT people often feel safe only socializing with LGBT-specific community spaces or social groups. However, these spaces and communities are often small and tight-knit. A tactic of an abusive partner can be to isolate their partner from their community and social support by taking over these spaces. So now I'll briefly talk about some resources that are available for LGBT youth in terms of teen dating violence. The Anti-Violence Project and Day One are based in New York City, and the Anti-Violence Project is specifically for LGBT and HIV-affected people. They offer legal support, counseling, advocacy. Day One is a youth-specific teen dating violence organization, similarly offering counseling, advocacy, legal support. Love is Respect is another great organization offering comprehensive services. The Trevor Project is a hotline that is geared towards suicide support, but can be used for many different challenges that LGBT youth experience, and it's LGBT specific, which is great. And the LGBT Center. We have the Youth Clubhouse at the LGBT Center, and it's an opportunity for youth to connect with pro-social peers, make friends, reduce isolation, find community, all in a supportive environment. So next we are going to hear from Walt.
Hi, my name's Walt Davies, and I work at the New York State Office of Alcoholism and Substance Abuse Services. I work in the Bureau of Prevention, and I've been there since around 2006. Prior to that, I worked in the alcohol and drug treatment field, and mostly working with adolescents and families. Today I'm going to be talking to you about the College Environmental Prevention Program. OASAS prevention services are typically delivered to youth 5 to 20 years old, pretty much kindergarten through 12th grade. Evidence-based prevention, mostly curricula-based, delivered in the school setting. Now, the goals of prevention services include reducing the prevalence of alcohol and substance abuse, reducing the number of youth using drugs and alcohol. This would also include problem gambling for all of these goals. Decreasing the negative consequences and costs associated with alcohol and substance use. And the third goal is a primary goal, delaying the initiation of alcohol and substance use among youth. It's a very important goal because we know that youth who begin drinking before the age of 15 are 4 times more likely of developing a problem later on in life than if they waited to the legal age of 21. We also know that younger bodies and younger minds do not handle alcohol, drugs in the same way that adults do. They get addicted sooner and have more problems. We also know that the brain continues to develop until the mid-20s, so delaying use is critical to healthy development. Now, while many evidence-based program strategies are used in the school setting, environmental strategies is a population-level change. It is a universal intervention in that everyone in the population is given the intervention. So the population could be a high school, it could be a college and the surrounding campus. Environmental strategies generally reach a greater number of people with the goals of reducing alcohol and drug use. To be effective, environmental strategies employ a three-pronged approach. So number one, enacting or improving a law or regulation or policy. This could be DWI laws, it could be the minimum legal drinking age of 21 law, could even be social host law. Number two, enhancing or initiating enforcement of the law, regulation, or policy. Laws and policies are only effective when they are enforced. And finally, the use of media to raise community awareness and support for the policy and enforcement activities. The three approaches work together. So the OASAS College Environmental Prevention Program, we have 20 colleges who are receiving the grant from OASAS. That would be 15 SUNYs or state universities and 5 CUNY universities in New York City. The grant is $2.5 million for 5 years. That's each year. The primary goal of this grant is to primary goal of the grant is to reduce and prevent underage drinking and drug use on college campuses. Now, some background on the college program. OASAS has never had dedicated funding or staff previously for a college prevention program. We have funded grants in the past like SIG-E and Healthy Communities, but nothing to this scale. So we're very excited about this prevention program. The college program also complements the Enough is Enough law and campaign to prevent sexual assaults on college campuses. I'll be discussing Enough is Enough law later on. College grants may be expanded at the end of the 5 years if they're successful. And the theme you'll hear through my talk is that by reducing alcohol and drug use in the college population, we're reducing some of the risks that students may experience. For example, getting hurt, DWIs, fights, and including sexual assault. The program objectives for the grant include decreasing access to alcohol and drugs in the campus community. This is the way that alcohol is procured and drugs in the community. Decreasing availability of alcohol and drugs, or how easy it is to get hold of alcohol and drugs. Changing attitudes and norms that foster underage drinking. So here we're talking about changing the culture on the college campuses, really winning hearts and minds. And finally, providing SBIRT services. SBIRT stands for Screening, Brief Intervention, Referral to Treatment, and we'll be getting into that momentarily. This slide provides a visual of the distribution of college grant recipients in New York State. We have 3 colleges in Long Island, 5 in New York City, 2 in the Mid-Hudson region, 1 in the Northeast, 4 in the Central region, 3 in the Finger Lakes, and then 2 colleges in Western, all receiving this OASAS prevention grant. On the left side of this slide, you can see results of a survey that colleges participated in this fall. The preliminary baseline results indicate that 61% reported using alcohol in the last 30 days. 36% reported binge drinking, which is 5 or more drinks in one sitting, and 75% reported at least one consequence from alcohol and drugs. The consequences can range from having a hangover to missing a test or more serious problems. The survey will be conducted again in year 3 and year 5 to measure the performance outcomes of this grant. This slide provides some national college prevalence. We can see that roughly the same percentage as in New York, 63% reported alcohol in the last 30 days. A slightly lower percentage of college students reported binge drinking, 32.4%, and 40% reported being drunk in the last month. We see that 22% of students reported marijuana use during the last 30 days. Now, despite the tragic heroin overdoses nationally and in New York State, only 0.2% reported heroin use in the last 30 days. So this data, indicates that alcohol and marijuana are our most prevalent drugs used on campus. And much of the grant will focus on reducing those drugs. The consequences from underage drinking are alarming, both in the severity of the problem as well as the national numbers. There have been some fairly recent deaths on college campuses in the news from excessive alcohol use, particularly at fraternities, Penn State and Florida State University, to mention a few. We can see that almost 600,000 students between the ages of 18 and 24 are unintentionally injured by being under the influence of alcohol. These unintentional injuries include falls, burns, maybe even using equipment, car accidents. We also see that 97,000 students between the ages 18 and 24 are victims of alcohol-related sexual assault or date rape. The victims of these sexual assaults did not give consent, and either the victim or the perpetrator or both were impaired by alcohol at the time. And finally, a little over 1,800 college students between the ages of 18 and 24 die from alcohol-related unintentional injuries, including motor vehicle crashes. So the college prevention key components. The first is the Strategic Prevention Framework, also known as SPIF. It is a planning process for preventing substance use and misuse. The 5 steps and 2 guiding principles of the SPIF offer prevention professionals a comprehensive process for addressing the substance misuse and related behavioral health problems facing their communities. The effectiveness of the SPIF begins with a clear understanding of the community needs and involves community members in all stages of the planning process. 5 steps of the SPIF include assessment, capacity building, planning, implementation, and evaluation. And as I said, College Prevention Grant utilizes environmental strategies to change the culture on college campuses. College grantees are also required to develop a campus community coalition. This coalition would include key stakeholders from the college and surrounding community. Ideally, representation from 12 sectors should be on the campus community coalition. This would include college students, parents, faculty, law enforcement for the community, including public safety from the campus, local business, healthcare professionals, faith-based, etc. And finally, SBIRT, intervention based on motivational interviewing strategies. First, the screening. We recommend universal screening for quickly assessing use and severity of alcohol, illicit drugs, and prescription drug misuse. We're basically trying to indicate flags for risky use of some students. Brief motivational and awareness-raising interventions given to risky or problematic substance users. So this is an early intervention which prevents the progression of use and to addiction. And finally, referral to treatment. Referrals to specialty care for patients and substance abuse disorders. Now I want to discuss some of the key requirements of the Enough is Enough law. And this program is being managed through the Department of Health, one of our partners. The Enough is Enough law was signed into law by Governor Cuomo in July 2015. The law is one of the most aggressive policies in the nation to address the issues of sexual assault, domestic dating violence, and stalking on college campuses statewide. It requires that all colleges and universities in New York State implement uniform prevention and response policies and procedures to address sexual assault, domestic violence, dating violence, and stalking. It also requires that colleges use a uniform definition of affirmative consent, which is defined as a knowing, voluntary, and mutual decision among all participants to engage in sexual activity. Consent can be given by words or actions, as long as those words or actions indicate clear permission regarding willingness to engage in the sexual activity. Silence or lack of resistance in and of itself does not demonstrate consent. The definition of consent does not vary based upon a participant's sex, sexual orientation, gender identity, or gender expression. Colleges and universities must have an amnesty policy that ensures that students, including victims who report incidents, are granted immunity for certain campus policy violations, such as drug or alcohol abuse. This would be similar to Good Samaritan laws. In addition, the law requires that college distribute a Bill of Student Rights that informs victims of their legal rights and how they can access appropriate resources. The Bill of Rights must clearly state that the students have the right to know that they can report sexual assaults and domestic violence to outside law enforcement, including the state police. And unfortunately, there are stories of certain students being discouraged of sharing these offenses with local law enforcement. So that's changing and is a very positive aspect of the law. Comprehensive training must be provided to students, staff, administrators, including training for new student onboarding and ongoing education. The training must include certain topics such as the definition from the law, including affirmative consent, confidentiality, sexual assault, awareness of violence and its impact on victims, and bystander intervention. Training must be provided to certain populations, such as new and transfer students, student leaders, and student athletes. The law requires annual campus reporting requirements for aggregate data on incidents of sexual assault, domestic violence, dating violence, and stalking. In addition, the law also creates a sexual assault victims unit within the New York State Police, which is a specialized unit having advanced training in responding to sexual assault and related crimes. The Enough is Enough statute specifies that colleges and universities that lack appropriate on-campus resources or services can enter into agreements with rape crisis programs to refer students for assistance or make available a range of supportive resources and services for sexual assault, domestic violence, dating violence, and stalking victims. State funding of $4.5 million was provided for services and expenses of rape crisis programs, with contracts administered by the Department of Health. The funding enables the Enough is Enough programs to do this additional work with the colleges and university. New York currently has 54 Enough is Enough rape crisis and sexual violence programs. Services are based on need of the colleges. This law requires considerable policies and compliance and does place demands on colleges. The Enough is Enough program contact their local colleges and universities and offer services to assist them in the implementing of the Enough is Enough requirements. Many have MOUs or partnership agreements with their local colleges and universities, but some provider services and assistance are through more informal agreements. Some of the resources available include a 24-hour hotline, accompaniment for victims for medical care, including forensic exams, advocacy for victims with judicial and conduct process, short-term counseling, case consultation for colleges, and policy development to assist with implementation of the requirements. This list may, of course, expand as Enough is Enough programs evolve. In thinking about the work that colleges have done with the OASAS grant and Enough is Enough providers, there are several opportunities for collaboration. As you know, sexual assault and intimate partner violence can sometimes co-occur. We're not saying that the alcohol or drug use causes the violence, but it can be a contributing factor. Or in other situations, a perpetrator may use drugs or alcohol to incapacitate someone to make it easier to abuse them. Colleges participating in any coalitions or working groups that already have been established through Enough is Enough, it is a great way for colleges to engage with other local stakeholders and be part of the conversation about campus sexual assault and the role of alcohol and substances may play. OASAS college grantees may also want to include Enough is Enough partners and representatives on the Campus Community Coalition. There may also be co-training opportunities on college campuses. Some Enough is Enough programs do address the role of alcohol, drugs, play with sexual assault. So there may be a natural fit for presenting information together. And in fact, staff from Department of Health have presented during college prevention webinars we've had recently. And I've been asked to speak at the Enough is Enough provider meeting in June. So co-training has already begun. Finally, the Safer Bars Nightlight Initiative is a perfect opportunity to partner. Joint programs could increase, for example, compliance in local bars and restaurants with the alcohol beverage control laws and also help to make students safer. I want to provide you with the link to the New York State Department of Health Enough is Enough web page that has more information about the issue of campus sexual assault, the Enough is Enough program, and other resources. Thank you for allowing me to provide information to you today on the College Environmental Prevention Program as well as the Enough is Enough law. These two initiatives are working to make campuses safer for New York college students. Thank you.
Hi, this is Patty, and I'm back again. This is the contact information for our 5 presenters should you need to or want to reach out to 1, 2, 3, 4, or all 5 of them. Your feedback as a participant is appreciated. It gives us the opportunity to gauge if we are meeting your educational and professional development needs. If you'd like us to hear your feedback, please just take a moment to do the SurveyMonkey at the link we have provided for you. I would like to thank you for joining us, and I would also like to thank the 5 presenters today. 3 of them came from different units at OASAS, and 2 of them came from outside agencies. So they did put a lot of time and effort into both coordinating and collaborating this venture. So I thank you for your time and effort. As always, I thank Media Services because you do a wonderful job in providing great behind-the-scenes service for us. All of you have a good day, and I will see you again. Bye now.